Have you suffered from years of embarrassment due to your spider veins? Do you avoid wearing cute shorts or dresses out of fear of people seeing them and judging you? Are you ashamed for having spider veins at such a young age? Well, stop feeling sorry for yourself and do something about it.
Do you suffer from spider veins? I know I do, and I've always wanted to get rid of them. Some of the causes of spider veins are heredity, having an occupation that makes you stand up for long periods of time or even sitting down for long periods of time, crossing your legs, hormones, or birth control. And spider veins occur in two common places, usually the face and on the legs, and they're much more prevalent in women than men. Now, there are a few ways that you can prevent spider veins, such as making sure that you wear compression stockings, or if you put sunscreen on your legs to prevent sun damage to the skin, or exercising. Exercising increases blood flow and circulation. But maybe that's not enough, and maybe you need an actual treatment. But if you think about the treatments that are available, they're kind of costly. That might include injections or laser treatments. Now, scouring through the internet, there are many do-it-yourself remedies, and I think that there are a couple that are worth trying. So today I will demonstrate two different remedies that I found on the internet, and I will continue them as recommended, and then I will follow up in a month to see the progression. The first remedy I'm going to try is using witch hazel. And all you do is take a cotton ball, soak it up with the witch hazel, and apply 2 to 3 times a day. The second remedy that I'll be demonstrating is the use of apple cider vinegar. And all you do is take a cotton ball, soak it in the apple cider vinegar, and then place it on the spider vein for 15 to 20 minutes. And then you'll repeat that 2 times a day. Okay, so I tried it on both sides, and I'm gonna come back and see how these remedies are working for me. Here is the side with the spider vein where I used witch hazel. I think for this one, still doesn't look like it's done much to it. Kind of still looks the same. So this is the result of using the apple cider vinegar on my spider veins, and this is after 1 month of using the apple cider vinegar. So as you can see, the results are not much change. It looks the same to me. I don't really notice any differences or seeing it being minimized. It has the same color, the same appearance. So it doesn't look like the witch hazel worked. It still looks the same. I don't really notice any changes in the coloration or the veins, so I don't think it's really made much of a difference. So as you can see, the apple cider vinegar and the witch hazel didn't really give me the results that I was looking for. But if you've tried the apple cider vinegar or the witch hazel and you had positive results, please leave a comment and let me know what your results have been, how long did it take for that to happen, and if you're happy with it and used it for various parts of the body, whether it's your legs or face. Please let me know in the comments. But unfortunately for me, I'm going to probably have to resort to some clinical treatments in order to actually get rid of these spider veins. If you like this video, please subscribe to our channel, give us a comment, or give me a thumbs up. Great. Talk to you later.
What are varicose veins, and what causes them?
Varicose veins are large dilated veins just underneath the surface of the skin. They're at least 3 millimeters in size and are associated with pain, swelling, discomfort at the end of the day, skin color changes, or open wounds. There are several different causes of varicose veins. However, the underlying reason are dysfunctional valves within the veins. Every single vein in your body has valves to bring blood in the correct direction from your body back to the heart. When there's chronic strain on these valves, they become dysfunctional. When they become dysfunctional, they lead to the symptoms we discussed.
Can varicose veins be serious? When should I see a doctor about varicose veins?
Varicose veins can range in symptoms from being completely free of symptoms to being associated with painful varicose veins or even being associated with open painful wounds. However, varicose veins rarely are life-threatening conditions. They may affect your quality of life, but they're not dangerous. I would recommend seeing a physician sooner rather than later, preferably a vascular surgeon. You can discuss lifestyle changes, compression stockings, and even treatment strategies to help manage your varicose veins and to prevent them from getting any worse.
What are the differences between varicose veins and spider veins?
I actually get this question a lot. So the main differences between varicose veins and spider veins are the size and associated symptoms. Varicose veins are at least 3 millimeters in diameter and are associated with pain, swelling at the end of the day, itching, skin color changes, and open ulcers. Spider veins are very small. They're bluish discolorations of tiny little veins just underneath the surface of the skin, and they're about 1 millimeter in diameter. Usually they are free of symptoms, and many patients seek care just because they don't like the visual appeal of them and they don't like the cosmetic aspect of them. In that case, they may be treated. Occasionally, however, spider veins may be associated with itching, burning, and discomfort, and in that case, treatment would certainly be warranted.
Who is most at risk for varicose veins? Do they only affect women?
There are several different risk factors for varicose veins. Mainly, if you're on your feet for long periods of the day or sitting for long periods of time, you may be at risk for varicose veins. Furthermore, if you're struggling with your weight, this may be a risk factor. If your mom or dad has varicose veins, it runs in the family, and you may have varicose veins at that point as well. If you're a smoker, if you're a female, if you had prior pregnancies, if you had leg injuries, or even prior blood clots, this can affect your chances of getting varicose veins. Now, varicose veins affect men and women, although they affect females twice as much as men. So in the United States, about 22 million females and 11 million men between the years of 40 and 80 are affected by varicose veins.
Will treating varicose veins affect the circulation in my legs?
That's a good question. So circulation refers to the flow of blood from the heart to the rest of your body. So your body is made up of arteries and veins. The arteries bring nutrient-rich blood from your heart to the rest of your body, and that is absolutely not affected by any varicose vein surgery. The veins are mainly responsible for bringing blood back from the body and bringing it back to the heart. Now, superficial veins are very close to the skin surface, and they are not major veins associated with the circulation in your body. The targeted dysfunctional veins are treated, and this again does not affect your circulation whatsoever.
Are the procedures done in the hospital? How long do they take? And is more than one treatment needed?
Varicose vein treatments are usually performed in the office setting. At the NYU Winthrop Vein Center, we have a dedicated vascular lab and a state-of-the-art procedure room in which we perform all the various varicose vein procedures that one may need. Depending on the type of treatment that you are being offered, as well as the targeted vein, the time of treatment varies. It can range from 10 to 15 minutes up to an hour. Most of the treatments may be performed only once. In the case of endovenous laser treatments or stab phlebectomy, usually only one treatment is needed. However, for sclerotherapy, when multiple tiny little veins are being targeted for injection, this may take multiple sessions to get the cosmetic result that one desires.
How do you treat varicose veins?
The first-line therapy for treating varicose veins is always non-operative therapy. You can try lifestyle changes such as weight loss and increased exercise, as well as the use of compression stockings to prevent pooling of the blood in your legs. This may provide many patients with relief. However, if non-operative conservative management fails and does not work, your physician can work with you to work up the exact problem that you have in order to provide you with several different treatment strategies. The first step in treating varicose veins is to perform a comprehensive ultrasound in which the physician will look at the size of your veins and the way your valves are functioning within your body. Once that is determined and evaluated, there are several different treatments that may be offered to patients. The first-line treatment that we often use is endovenous ablation therapy. This has largely replaced vein stripping and vein ligation in many practices. What it basically consists of is placing a very thin little fiber into the problematic vein and sealing it shut with heat. The heat may be in the form of laser or radiofrequency. When laser is used, it's called EVLT, or endovenous laser therapy, and when radiofrequency is used, it's called RFA, or radiofrequency ablation. Another ablation technique is called mechanochemical ablation, or MOCA. This is a newer way of sealing off the vein without using heat. It basically uses a rotating catheter and the injection of a solution to close down the problematic vein. It's generally quicker than EVLT or RFA and a little less painful. The third major treatment option is stab phlebectomy. Stab phlebectomy involves using very tiny 1 millimeter incisions over each of the vein branches or prominent veins. In that case, a small tiny vein hook is placed underneath the skin and the vein is removed. Patients can have this procedure in the office with local anesthesia and very minimal discomfort. And finally, sclerotherapy is a way of treating spider veins on a cosmetic basis most of the time. It involves using a very small needle that is barely perceptible to the patient when it is injecting the solution that causes inflammation in the vein and closes it down. Again, with sclerotherapy, you may need more than one session to help achieve the cosmetic results that you desire, but it's virtually painless.
How quickly will I get results? And will the varicose veins come back?
So how quickly you see results depends on the type of vein being treated and the type of treatment that is offered to you. In the case of endovenous laser therapy or stab phlebectomy, it may take you up to a few days to a few weeks to have complete resolution of your symptoms. For sclerotherapy, you may need multiple sessions to get the cosmetic result that you want, so it may take up to a month to actually see the type of results that you're looking for.
Are these treatments covered by insurance?
If your varicose veins are symptomatic and conservative non-operative therapy has failed you and you still have symptoms, usually insurance companies will cover any procedures needed to help treat your varicose veins. However, if you're seeking treatment for cosmetic reasons, many times insurance companies will not cover those costs. I definitely recommend you see a physician to discuss different procedures and their pricing options in greater detail.
Where can I get more information about varicose vein treatment?
For more information about the NYU Winthrop Vein Center, call us at 1-866-WINTHROP or visit us online at nyuwinthrop.org.
Health Info Talk provides health and medical information that is quality assured, reliable, up-to-date and easy to understand.
Varicose veins are veins that have become enlarged and inflamed, which not only makes our legs look bad, but also causes severe discomfort and a feeling of heaviness that often prevents from handling our daily lives activities. Varicose veins can be mild or severe, and there are a lot of treatments for it. If your varicose veins are painful, vinegar can give you temporary comfort and can also lessen their appearance until you see a doctor. Vinegar is very effective in strengthening blood vessels and hence can reduce symptoms of varicose veins. Vinegar also helps reduce the inflammation and the symptoms of varicose veins. It also helps break up harmful toxins in the blood vessels and improve circulation. Vinegar also increases the tone and elasticity of capillary walls. This makes capillary walls more resistant to hemorrhages, ruptures and infection. Method: get a bandage and soak it in apple cider vinegar or white vinegar. Tie the bandage around your thighs or lower legs or wherever you have varicose veins. Leave the bandage on for half an hour. Remove the bandage, and wash your legs. Repeat this every day. Topical application: take some vinegar in a bowl and use it to massage your skin that has varicose veins until it gets dry. Do this every time after you have a bath.
Thank you for watching Health Info Talk. Please subscribe to our channel for regular updates and news. and do like our FB page. www.facebook.com/Health Info Zone. Follow us on Twitter at HealthInfoTalk1.